Yeah, greetings from Izmir. Nice to meet you and nice to see you again. We are starting our conference with a keynote presentation. The theme for this session is Data Science for COVID Response and Impact. We are pleased to welcome Professor Olavande Daramola from South Africa. He's a computer scientist who is specialized in applied software engineering and artificial intelligence. He's interested in applying AI to software engineering. His research interests include semantic technologies like ontologies, use of knowledge graphs in software systems in real-world domains. He's also an active researcher in AI, big data analytics and machine intelligence. He currently works on projects on Explainable AI, AI for healthcare and health data science. And yes, his keynote presentation will be on AI and data science for COVID response in resource-limited settings, affordances, possibilities, and challenges. Yes, we are pleased to welcome Professor Olavande Daramola again for his presentation. Thanks. Professor Olavande Daramola.
Okay, good morning, everyone. Can you hear me?
Yes. Mm-hmm.
Okay, good morning, everyone. And
yes.
I really appreciate the privilege to be part of this symposium. My appreciation goes first to Dr. Bolanle that contacted me. And then it's a pleasure for me today to also meet all the organizers of this important workshop, starting with Professor Lee, the head of TUAS, and all the other executives that have spoken this morning. This morning, I'll be giving a talk titled AI and Data Science for COVID Response in Resource-Limited Settings, Affordances, Possibilities, and Challenges. By way of an outline, I will start by giving an overview of the affordances of AI and data science for COVID-19, the challenges that currently exist, the enablers in terms of possibilities for the future. I will also be focusing on some policy issues that are very, very important, because without that, everything that is said would just be purely academic without really having any practical implication that can actually bring some of these things into reality. I will also give you an overview of a few of my ongoing projects that are related to this topic, and then share some closing thoughts. Well, just to start by saying that I work for the Cape Peninsula University of Technology in South Africa. Is a university that was established in 2005. However, that was due to the merger of two institutions that had been in existence for a very long time. I think maybe close to 80 to 100 years. The student population is over 30,000. We have 70 academic programs, and we have 6 faculties. I belong to the Faculty of Informatics and Design, and of the Department of Information Technology, where we train students right from the diploma to the doctorate. And we do research in AI, software engineering, information systems, health informatics, and computer networks. Now, getting into the topic. For COVID-19, Marcus and Silva, in their paper in 2008, also drawing from bases already laid by other researchers, actually defined the concept of affordances as the possibilities for goal-oriented action afforded to specified user groups by technical objects. Now, in the context of our discussion this morning, the technical objects will be AI and data science. And the specified user groups will be the different category of stakeholders that could actually benefit from what AI and data science has to offer. So in that context, we can actually look at AI and data science affording goal-oriented actions for patients, for healthcare workers, for healthcare systems by way of hospitals, centers, and also for government in terms of COVID-19 surveillance and response to pandemic. Also affording benefits for the different ministries of health or departments of health that are tasked with formulating strategies and programs for and also for scientists who are actually involved in the business of drug design, you know, of COVID-19. So in essence, really, AI and data science have stakeholders that belong to this, that are actually related to what we are talking about. Now, the Organization for Economic Cooperation for Development, OECD, actually profiled the different aspects of application of AI for COVID-19. They talked about early warning, AI being able to actually provide early warning for detecting anomalies of existence of COVID, diagnosis based on medical imagery using computed tomography, x-rays, and all that, and also symptom data. And then also in terms of prevention, prediction of who is likely to be infected, or looking at the prognosis or the maturity of infection, COVID infection in people, particularly those with pre-existing conditions. Surveillance in terms of monitoring and tracking persons that have been infected in real time, maybe persons under quarantine, ensuring that they don't infect other people and that they follow the schedule that has been prescribed for them in terms of staying at home and not moving around. Also in terms of tracking fake information, and really with respect to COVID, there were actually a lot of that, and AI can actually help to track that. Also in terms of delivery, drones for materials, transport, robot for high exposure, tasks at hospital, to ensure that humans are not unnecessarily exposed to infection of COVID. And also service automation, deploying triaging, virtual assistants, and chatbots. And there are, for all of these, are actually examples of AI solutions that have been deployed in different places, to realize some of these objectives. And also in terms of recovery, monitoring patients, monitoring the rate of spread, track economic recovery through satellite, GPS, and social media data. So all of these are possibilities that are afforded by AI and data science as far as COVID-19 is concerned. And really, since the advent of COVID, researchers have given a lot of attention, to several of these aspects. For example, a search on PubMed, which is the topmost index database for biomedical research or biomedical publications, as at December 2nd, that was yesterday, there were 732 documents, that focus publications by way of articles, peer-reviewed papers that focus on artificial intelligence and COVID-19. Also, a search on Scopus also revealed 112 documents. So that is to show that really a lot of attention has been given to the issue of AI and COVID-19. Now, looking at some of the research that has been done, particularly of recent in terms of a very important finding that came out, reported by a paper by Hadley et al., 2020 in the Journal of Medical Internet Research. The authors actually identified 10 most recent applications of AI for COVID that is also likely to be relevant in the future. And looking at this, they actually found that application of AI for detection of suspected cases, large-scale screening, patient monitoring, pneumonia screening are quite prevalent. A lot of effort has actually been made in these areas. A lot of solutions already exist in these areas that have been reported. However, the aspect of using AI and data science for prediction, particularly in the area of prognosis, maturity of diseases, risk assessment, is not as common. And then, of course, modeling and simulation of the trend of development as far as COVID is concerned, and also robotics for medical quarantine. So these are aspects that are relatively few compared to the first category. And then there are also fields of application that are, for now, that are largely non-existent or rare, not very common, like using AI for resource allocation and the use of intelligent Internet of Things for data and information gathering and integration, and interaction with experimental therapies. That has to do with experiments that are currently going on to see whether certain drugs can be repurposed for the purpose of treating COVID-19. So these are aspects that we are likely to see more application of AI as we go into the future. However, all of these things are things that are largely taking place in the developed world. Most of these advanced approaches, application of AI methods, are things that are happening currently in the developed countries. Not so much of that is happening in sub-Saharan Africa, which, because of so many issues that deals with resource limitation, can be qualified as resource limited settings. Now, what are the attributes or properties of resource limited settings? These kind of settings are characterized by low resource hospitals in terms of poor and inadequate healthcare facilities, ICT infrastructure, even things as basic as constant electricity supply are absent in many of these places. And then, of course, there's also the issue of shortage in terms of human resources, shortage of qualified medical personnel, materials, human resources, healthcare workers. For example, Nigeria, for example, has a doctor-to-patient ratio of 4 to 10,000. Whereas countries like the US has 26 to 10,000, UK has 28 to 10,000. And even looking at this 4 to 10,000, most of these doctors are largely concentrated in the urban areas or the well-developed cities. We actually rarely find highly qualified doctors in the rural areas of Africa. So which it's a major resource limitation in terms of the quality of healthcare that people in rural areas can have access to. There are also issues of high cost of healthcare for common people because of high level of income disparity between the rich and the poor. There are people that are buoyant financially enough to access the best medical care anywhere in the world. At the same time, we have persons that could not even afford to buy simple drugs to actually take care of themselves. So these are all characteristics that we see in resource-limited settings. Of course, there are also issues of underdevelopment, socio-economic challenges, poverty, lack of access to technology, financial resources, and so on and so forth. So all of this makes the desire to apply AI and data science for COVID-19 and general, and even for healthcare in general, to be more difficult and more complex in resource-limited settings. And so that imposes a lot of challenge. That imposes a lot of challenges actually for researchers, because the implication is that whatever it is that is known to work elsewhere will not necessarily work in these settings. There will be need for some form of contextualization, adaptation to ensure that these brilliant ideas, as far as the application of AI and data science for COVID-19 and healthcare in general is concerned, to be able to be made to work in these kind of settings. However, it's been established that indeed, despite these limitations, AI and data science can be used for prediction of outbreaks, even in resource-limited settings. And when this is done, it can actually bring about speedy and accurate identification of cases. It can help with COVID-19 screening, contact tracing, and diagnosis. It can also help with patient monitoring and also drug development. So all these are possibilities actually that could be realized even in resource-limited settings. So in essence, AI and data science can be a solution. In fact, could actually be the game changer as far as quality healthcare is concerned in resource-limited settings. Which actually describes a lot of countries and provinces and states and towns in sub-Saharan Africa. However, to move forward on this, we need to think about the challenges and actually to see how some of these challenges can be addressed. A major challenge for the application of data science and AI for COVID-19 and generally in healthcare in sub-Saharan Africa is the availability of usable data sets. There are just not enough usable data sets that can actually support AI operations. In fact, in most cases, this is largely non-existent. The data actually exists, but not in the form that they can be used. In a lot of hospitals, things are scribbled on paper, kept in files, and all of that. So there's actually a lot of challenge here. And another problem really is that most of those things written in files are not even legible. Doctors are trained to actually write in a particular way so that prescriptions and their writings are not what just anybody can read. They use a lot of shorthand and all of those. It's part of their training, just to ensure that medical data is kept private and all of that. So we don't really have electronic medical records. So data are not really available in the form that it can be used to support AI purposes. Also, the quality of the data. In instances where even we have some form of electronic documentation, a lot of time this data is not complete. And the reason is because the data were not really curated for the purpose to support some advanced computational procedures. So data needs to be labeled. So a lot has to be done in terms of actually ensuring that there is sufficient data, because big data is actually the science of data. So if really there is no sufficient data, then that is a huge limitation that has to be addressed. Of course, there is also the need to also make plans for the uptake of application of AI for COVID and generally for healthcare. Currently, there are no regulations or guidelines that actually support the use of AI for healthcare in most African countries, and many are not even thinking about it yet. So these are bottlenecks or challenges that has to be addressed. There's also the culture, the work culture, and the orientation of healthcare professionals is such that most of them are not really inclined to use technology to facilitate their operational procedures, because a lot of time that was not part of their training. So there will be a need for a lot of orientation to ensure that the healthcare workers are ready to actually integrate digital technology into the workflow during healthcare. Also, we have a lot of systems that exist in isolation, what we call health system silos, different kinds of healthcare solutions, even when some form of automation exists, and there is actually no platform for interoperability, where some of these systems can actually be integrated so that data can be transferred seamlessly from one platform to another. So all of these are things that makes the desire to actually have elaborate AI and data science methods applied in healthcare very difficult in resource limited setting. And of course, the issue of infrastructure is also there in terms of having adequate ICT infrastructure, broadband, internet technology. Even when this is available, it's very expensive. So all of these are challenges that we actually need to think about before this vision can actually be realized. But in terms of enablers, which will be like the solution or the response to these challenges, there must be, for example, a plan and a strategy for data curation, deliberately collecting data, aggregating data, ensuring that the data has sufficient quality that can support computational procedures, creating data sets that could be the basis for an AI algorithm to do prediction, diagnosis, and all the other computational operations that are essential. Also, there's need for system integration, creating interoperable platforms, and a lot of decisions need to be made, on that. For example, you want to avoid, for example, issues of vendor lock-in. When an hospital, for example, what kind of choices what choices can an hospital make to ensure that even if a particular vendor ceases to be the one managing the system, they are not locked or perpetually at the expense of that particular vendor. So adoption of open source platforms, for example, could be the way to go, or ensuring that systems are built on open standards. So these are decisions that needs to be made if we are really going to be able to realize this. There's also the need for policy support, policy framework for AI adoption, ethical framework, governance of AI in healthcare. In most countries, these are largely non-existent. I think the only country that I know in Africa that is giving some thought to this now is South Africa. For example, South Africa has an ethical framework for telemedicine, and they are currently thinking about also a framework for AI in healthcare and all that. But a lot of other African countries do not seem to actually be giving serious thoughts to this. And so it will be difficult, really, to do anything elaborate in terms of application of AI and data science for COVID-19 or even for healthcare in general. And then, of course, very important is the need for quality training and education. Currently, there's a shortage of skills, relevant skills in data science, in AI in Africa. And the time to actually address this is now. In fact, one could actually count the number of African universities number of universities in sub-Saharan Africa that have a data science program. I'm looking at Nigeria and I'm not able to see so many. I'm not even aware if there is any university that has an undergraduate program in data science. So these are things to actually look at, and that applies to a lot of other countries. In South Africa here, it's actually better because people are actually thinking about that. And there are universities that are actually floating programs, masters, bachelors in data science, in relevant areas, health informatics, bioinformatics and all that. So these are things that are needed because really, the challenges of our time is such that we should not just study computer science for the sake of it. We should not just study statistics for the sake of it, even mathematics for the sake of it. We should study all these subjects for the sake of solving practical problems that can actually help us to have better nations, better environment, and all that. Now, talking in terms of the need, but assuming that all these challenges are surmounted, just furthering my thoughts on the need for an ethical framework, is the fact that there is the need to give some thoughts to certain aspects, because adopting AI, either for COVID or for healthcare, will come with some implications. And that is, and answering those questions is what, having an ethical framework will actually help to think about some of these questions and try to answer them. For example, who should be made accountable for the result of an AI system? Who takes the liability or the credit for the performance of an AI system? Is it the doctor, or is it the system, or is it the designer or the manufacturer of the system? So these are some of the aspects that an ethical framework will make very clear. Who takes responsibility? If something goes well, do we say that the doctor has done well, or is the AI system that has done well, or is the manufacturer that has done well? So all of these aspects are things that having an ethical framework will actually help to clarify. What conditions should guide the use, the privacy and protection of personal information? What level of authorization or informed consent is necessary, for example, for an AI system to look at somebody's electronic medical records and on the basis of that, make a prediction or make a diagnosis or make a suggestion or give a suggestion to the doctor? In what state should this individual be such that getting that consent is compulsory compared to when it may not be necessary? For example, if somebody is under an emergency situation, somebody is involved in a car accident, for example, and an AI system is actually needed to get to know certain things about the individual, who gives the consent under that condition to say whether that information should be used? Of course, we know that if that information is used in a timely manner, perhaps life can be saved. And if it is delayed, it could also lead to something that is not desirable. So all of these are things that an ethical framework will actually help to clarify. What is the degree of trust that could be reposed in AI system? Under what condition should we consider results of an AI system as sacrosanct? Something that is believable, credible, that should be used? Under what condition should it be considered just supplementary or complementary to what an expert thinks? So all of these are things that having an ethical framework will actually help to clarify. And then, of course, what are the social implications of the use of AI in healthcare? So all these questions need to be answered. There must be a framework that provides very clear guidelines on all of these issues before we can say that we can have full-scale adoption and utilization of AI in healthcare in sub-Saharan Africa. But for now, some of these policies, these actually are largely not existent in most countries, unlike what you have in Europe. For example, in Europe now, there are AI laws. There are countries that have also implemented, AI laws that actually provide a form of governance for the use of AI systems. For example, you have the General Data Protection Regulation that actually stipulates that, talking about trustworthy AI, what is expected of an AI system, under what condition, what is it, that specify how results of AI system should be presented and how it should be used. So these are things that are actually essential that we need to have. I have a few projects that are related to this, which I would just like to talk about as I close. My research interests pertaining to this, I've looked at aspects of explainable AI for healthcare. I've also looked at semantic integration of health data sources and health information systems, which is actually talking about system integration. I'm also interested, and I'm actually doing something in the area of AI-based point of care diagnostics. Okay, that considering the fact that, for example, the observation in sub-Saharan Africa, in a lot of African countries, is that areas where a lot of testings, COVID testing are taking place, recorded very high numbers. And some areas where no testing is taking place, recorded very low numbers or even no instance of COVID at all. But the real problem really is that there are actually no testings taking place. So is it possible to create a platform that can make testing to be more accessible to more people, particularly those in the rural area? We've actually submitted a research proposal for this. Now, talking about explainable AI is the branch of AI that seeks to generate explanation from an AI model. Explanation is the ability of the model to satisfy a user's need to understand the decision or the result that was produced, and also to understand how that result was generated. This is particularly important for healthcare, where credibility it's of utmost importance. However, what we see as far as AI, particularly machine learning models, are concerned is the fact that there is a kind of, there's an inverse proportionality in terms of accuracy and ability for explanation. The typical AI models that are very strong, that have stronger explanation capability, are not the most accurate. And the most accurate are typically black boxes, as it were. So for example, when we look at, rule-based systems, using classification rules, if-then rules, very easy for anyone to understand, regression algorithm, decision trees, graphical models like Bayesian networks, Markov random fields, that are based on probabilistic, that are based on probability, are actually easier to actually understand compared to support vector machines or assemble methods like different combinations of random forests, boosted trees, and so on. And of course, artificial neural networks and deep learning networks. So now, these ones, so we see that as accuracy, because actually the machine learning models that are very, very accurate are typically black boxes. They may generate very good results, but the basis for those results are very difficult to understand or to explain. And so that is why there is need for explainable AI. How do we get to that point where we can actually have accurate results from AI system that can also be understood by persons that need to use those results? So the need for explainable AI, so if you look at what we have here, for example, we have an AI system that could be applied to different domains and all that, be it transportation, finance, security, legal, domain, medicine, or military, and then produces results for the user. But the user is asking, why did you do that? Why not something else? Why do I get this result and not something else? When do you succeed? When do you fail? When can I trust you? How do I correct an error? All of these questions are necessary, not only for the user to be able to understand the basis for the result that has been generated. It also helps the system for the user, if he's knowledgeable enough, to know how to optimize even the performance of that system. And that is what makes explainable AI to be a very hot topic that is actually very, very interesting. Because for now, really, in terms of performance, I think that based on what we can see, and the particular performance of deep neural networks in some areas like computer vision and image recognition, the performance is exceptionally brilliant. So really, in terms of performance, accuracy, we're at a point where we are actually very comfortable. As long as data is available, we can be sure that there are very powerful AI models that can give very good results. But having an explanation that justifies those results is what researchers are really keen about right now. And so on the basis of that, I have this ongoing project, which is called Semantics for Explainable Decision Support Systems. And really, we're actually looking more at clinical decision support systems that will be used in healthcare. And the idea really is to use semantic technology like ontologies, knowledge graph, even natural language processing to actually aid machine learning algorithms that are used as basis for decision making to provide decision support in healthcare. So Explainable AI is concerned with interpretability of AI system to ensure that AI system have capability to provide relevant explanation that can make humans to understand the basis and rationale for the result that they produce. The explainability of AI is crucial to make their decision to be comprehensible, interpretable, transparent, retraceable, and reproducible, which will provide basis for increased trust and reliability in their results. So far, existing methods of explainable AI that are designed to enable interpretability of intelligent systems have been found to be deficient in terms of providing accurate explanation, a convincing basis for justification and consistency of explanation in different but similar scenarios. The research will investigate how the infusion of data semantics and semantic web approaches could help to alleviate the challenge of existing methods in the context of explainable decision support systems. And so that's what we are looking at. So the idea here is actually to see how some of these semantic web technologies, NLP, semantic web, resource decision framework, RDLs, and all of that, web of data, linked open data, ontologies can actually be used to aid traditional machine learning models like deep neural networks, support vector machines, or whatever it is, the decision trees, random forest, just to ensure that we're able to generate explanations for the results that are produced. And in this research, we're actually asking a number of questions. For example, how can semantics and ontologies be used to enhance explainable systems? How can semantics and ontologies be used to facilitate neural symbolic integration for explainable AI systems? How can semantic knowledge infrastructures be developed in order to engender context-aware and personalized recommendations for explainable system? We are now in the days of what we call precision medicine, for example. How can we use semantics to actually facilitate that? And then how can semantic knowledge infrastructure be used to provide support for the development of explainable systems? That is, in the process of even creating these explainable AI systems, can we actually use semantics to produce better systems? So these are things that we are looking at. It's an ongoing work. It's open for collaboration. And so I'm open to actually collaborate with persons that are interested. But just to give a conceptual idea of what we are trying to do in this research, the idea really is a problem definition. So typically we are looking at the domain of clinical decision support systems. And then we have this semantic infrastructure. It could be ontologies or semantic data labeling or knowledge graphs. And we want to use that. And then we have the symbolic learning framework. So we have the AI model, the machine learning models here, or even AI, typical AI models, case-based reasoning, Bayesian nets, whatever it is. But we want to use these semantic resources to facilitate explanation, such that at the end of the day, we have the result or the outcome, and then we also have explanation and the decision of the results. That's actually the idea of what we are trying to do in that research. And that has actually, that's kind of laid a kind of foundation for two other projects that I'm currently involved in. This project, Semantic Integration of Multiple Health Data Sources for Treatment Decision Making, called the Centric Project, is actually a funded project by the National Research Foundation of South Africa and also the Austrian Research Federation. So I have a partner from Austria that we are working on this together. So the Centric Project is an investigation of the semantic integration of multiple health data sources in order to improve the efficiency of treatment decision making for some selected diseases that are associated with gait impairment. So we're actually interested in diseases that, by virtue of their chronic nature, affect the gait, the posture of the patient. And this is relevant to Austria and South Africa. So essentially, for this research, we are looking at linked open data sources. This is semantic, this is a semantic resource. We are looking at epidemiological data. We are looking at electronic health records, and we are looking at real-time gait analysis data. So all of these, we want to combine together in order to actually make intelligent recommendations that could aid treatment of persons that have gait impairment with respect to some of the diseases in red that we have here. So HIV, tuberculosis, diabetes, dementia, Parkinson's disease. These are diseases of the elderly, alzheimer's and all that. And the good thing about this really is that research has shown, for example, the link between this and COVID is the fact that research has shown really that COVID alone really kills. I mean, a lot of people that died of COVID did not really die just because of COVID. They were people that had underlying conditions, which are called comorbidities. So this is actually relevant because if we are actually able to tackle this, then that will actually help. I mean, if persons with underlying conditions of HIV or tuberculosis have COVID, this can actually help to actually ensure that they get better treatment. Also, there is also this, we have a proposal submitted for this AI-based framework for multimodal diagnostics and management of COVID-19 and associated comorbidities in resource-limited settings. Just for the purpose of time, what we are trying to do here is to create a multimodal framework. We know that for now, there are different modes of testing for COVID. That is what we call molecular-based testing. That is the PCR-based test, where samples are collected from the individual. There are also genetic-based testing that are done that could be used as a basis to actually detect if somebody has COVID or, I mean, likely to have COVID. And then radiological image-based diagnostics. Chest X-ray scans can actually be used, you know, in terms of what we call COVID pneumonia. So all of these are different methods of testing for COVID. So the idea in this research that is proposed is to provide a platform for the triangulation of these various methods. And the idea really is that somebody somewhere may not have access to molecular-based testing, somebody may not have access to genetic, somebody may not have access to radiological, but whichever one that the person has access to, that could be a basis to actually provide a starting point to know whether this person has COVID or not. And where somebody has access to multiple methods of testing, this framework can actually help to compare the results to help the medical practitioner to make more informed decision. Maybe in terms of having better conviction that yes, this person is actually, this person actually has a problem with COVID and all that. And then, of course, we want to do that in such a way that individuals, even those in the rural areas, can capture their own data. So maybe somebody can actually, maybe has an X-ray report, he can just take a photograph of it and send that image, you know, over the internet to a server that will be, you know, where it can be processed and all that. Or maybe he wants to actually fill a form online, just describing how he's feeling and what is happening to him or her. There's also case data capture. There are instances where healthcare worker can actually call somebody and collect all the data, maybe via through a telephone call and all that, and actually report that. Of course, so all these, when we have this data, that will be used to facilitate explainable decision support for patient triage. So we determine when somebody is at a level where it needs to be admitted, or whether it can do self quarantine at home and all that. Disease diagnosis, contact tracing, post-treatment management. A lot of complications actually occur after people have been treated for COVID. So we also want to use this framework to be able to track them, stay in contact with them, know exactly what is happening to them. And then, of course, because we are looking at resource-limited settings, communication should take place, for example, in local language that the patient is actually comfortable with. And then, of course, also providing accessible mode of communication, something that is cheap and cost-effective, maybe using Telegram, for example, or SMS or mobile phone. So these are the things that we've put together in the formulation of the idea of this AI-based multimodal framework. And the idea of a framework here is that this is something that could be realized in multiple settings. So for example, depending on data that pertain to a particular setting, this particular framework can be customized. Actually, for this study, we're actually looking at South Africa and Nigeria. So the idea is actually to have an implementation that can be contextualized, okay, for the Nigerian situation and also for the South African situation using selected sites. Now, my closing thoughts, just to say that AI and data science for COVID and generally for healthcare has a lot of benefits in terms of improved healthcare services, accuracy, it can facilitate accuracy and prompt decision making. Also, it creates new opportunities, human-machine synergy for improved healthcare. So it's not just the humans taking the decision. Actually, it's been proved really that the human-machine synergy is better than going the solo way. That is to say that frameworks or strategies that, that harnesses what humans do best and what machines do best, bringing them together produce better results than going purely with human approach or going with purely machine approach. So that platform or that point is actually created. And then, of course, AI-assisted telemedicine. With the advent of COVID, there's been an increase in the adoption of telemedicine based approaches for healthcare, where the doctor is not necessarily is away from the patient and there's interaction, remote interaction, and yet the patient can be helped. So AI can actually help to facilitate that, and also the concept of robotics can also help. There are also instances where even when some form of interaction needs to take place, it need not be the human that is there, maybe to minimize the problem of infection and all of that. So robots can actually do that. And there's actually a lot of advancement along those lines that makes that to be something that is a possibility going into the future. Things to do in terms of obstacles, the obstacles are still there. Usable data sets, we don't really have them. The culture needs to change. There is still the issue of skills shortage, which are things to actually address. And as far as government is concerned, all of this cannot be realized without support from government, policy support, funding support, because research costs money. And of course, investment in critical infrastructure. So thank you so much for enduring me. I stop here. Thank you.